Hello again. A reminder, first of all, to subscribe to my free newsletter. Each week you'll receive 3 hacks to a healthier life and simple ways to improve your well-being, along with the latest medical advice, all straight from the show to your inbox. Just go to drhilaryjones.com. Now, my guests today work at the forefront of modern hair restoration. Royce is a trichologist and hair consultant at the award-winning Wimpole Clinic, known for her expertise in brow transplants and more intimate procedures. And Dr Moussa is highly qualified as a neurosurgeon with more than 15 years' experience. His expertise includes performing complex awake brain surgery and now uses his expertise to perform hair, scalp and beard transplants. Welcome, Royce and Ahmed. How are you both?
Thanks for having us. We're great.
It's a pleasure. Well, this is such a growing area, and I think people might be surprised to know that hair transplantation has actually got its roots way back in history, back in the 19th century, but it wasn't very successful then. And in fact, it wasn't until the Americans started doing it in the mid-1950s that it came over here, and it's made enormous strides in recent years, hasn't it? I mean, what we can achieve now is incredible. Ahmed, what can you achieve these days?
I mean, we see patients that are really struggling with things. You know, they've lost a lot of hair, they've lost their confidence, and we can change their lives. Going from being very bald to getting a good head of hair again is very much achievable. And more people are wanting it, more and more people are going for it. And the results speak for themselves. It is a booming industry.
Absolutely. So even a few years ago, people would say, well, they've obviously had a hair transplant because the results weren't brilliant. And in some respects, people would be worried about being laughed at for undergoing what was kind of experimental in a way, or at least in its infancy. But now the results are really very good, aren't they? Lots of people would not know that someone had had hair restoration and have a full head of hair.
Yes, that's very true. The instruments we use have got finer and finer. We're able to take a larger number of grafts and just take the grafts themselves rather than taking big clumps of skin and putting it on, where you have these sprouts of hair that just look like random palm trees on people's scalps. But nowadays, you can do a large number of fine grafts, and in a normal social situation, normal conversation at work, friends on a night out, people wouldn't be able to tell. Even in the industry, the good ones, after a few years, we would have to get up and start ruffling through people's head to be able to tell that it was a transplant.
Right. We're going to learn more about the details in a moment, but let me come to you, Marie, because you're performing hair restoration in other parts of the body other than the scalp. We talked about intimate areas. What kind of areas are you able to transplant hair to?
Well, really, you can transplant hair anywhere on the body, but we're seeing a huge rise in people wanting to restore their pubic hair. So the fashion was, of course, to have your pubic hair lasered off. And we see lots of women regretting this or wanting it. Recently, I had a potential patient come in, and she recently lasered her pubic area off, and she quite quickly regretted it. So it wasn't something that happened over time. She really panicked and said, actually, why did I do this? I want my full bikini back. So it's something that we will be, helping her with.
Well, that's really interesting, because as an NHS GP and a private GP, it's not an area that I know anything about. Mm-hmm. I mean, I didn't even know that women were lasering their pubic hair away. Yes. I thought they were shaving, or we talk about Brazilian,
lots of different designs.
Sure. But this is something that's been going on for some time,
really
removal of pubic hair.
Yes. I find it's really interesting, actually, because it's so natural. But sometimes, people look at that area as being unclean if it isn't, groomed properly or lasered away, and they want it permanently removed, because it is a chore for women to constantly go, and painful. So painful. I don't know if you've ever had wax before, but it is not pleasant. To constantly waxing down there is a chore and painful. So they do have these permanent procedures done to, just to have an easier life.
Well, hold that thought. We'll come back to this. I'll go back to scalps for a moment. So what is the most common procedure? And we're talking presumably about men with male pattern baldness. So they've lost hair at the temple area and perhaps on the crown of the head.
Androgenetic alopecia is quite a common condition, and it's where people start to lose the hair on the tops of their head. The hair on the back and side always remains, and if it goes back to embryology, when babies are being formed, the part of the skin around the back and sides comes from a different layer to what comes on top. We don't know the full details, but for some reason the roots on the scalp on top can be susceptible to hormones, and they can weaken and wither and eventually stop producing hair, and this is where they go through male pattern baldness. So what we do is we take the strong roots at the back, the ones that are immune to the DHT, and we take those roots out and we transplant them back on top of the head. That's by far the commonest procedure that we do.
That's the strip that's
so
taken.
There's two ways we can do it. We can do the strip, which is a strip of skin that gets taken out and cuts into individual follicles, or more commonly these days men tend to go for the FUE, where we take individual roots out. The reason men tend to go for it is it allows them to wear their hair a lot shorter at the back without noticing too much of a change. The strip, although a very, very good procedure and it has its place in certain situations, it will leave a long, thin surgical scar. So men need to be a little bit more careful with how they cut their hair at the back and how they style it if they go for that. Ladies, for example, with long hair will always go for a strip.
Okay. So when men come to you to talk about this procedure, are they psychologically affected by their hair loss? Is it a major issue? Is it a vanity thing? Is it I'd just like to have a bit more hair? Or are some of them actually really very upset and quite disturbed by what's going on?
So I made the mistake a long time ago of thinking it was about vanity, and I was very reluctant to go into the industry because I thought it was about vanity. And someone said, just come down for a few days and meet them and see what you think. And I remember one of the first patients I saw, got him ready, drew the hairline, got everything sorted, and, asked him, do you want to pop to the toilet? He said, yes, please. And just to pop outside the room across the corridor, he had to put a hat on his head. He physically couldn't face the outside world with a balding head. And I was a little bit surprised, but didn't think much of it. And then another patient came in, and I got talking to him. And he'd had his transplant a couple of years beforehand, so he'd just come to show off his results, say hi and thank you again. And he was one of life's big achievers. He was a company director, done a lot in life. And he said, leading up to the procedure, he'd realized he was avoiding photos. So the kids' birthdays, family holidays, he just wouldn't be in the photos. He'd take the picture, he just wouldn't be in it. The crunch point for him came as part of his job. He had to periodically give presentations, so stand up and talk in public. And he found that he would get up to talk and he'd be more focused on how his hair was looking rather than what he was supposed to be talking about. And that's when he decided to have something done about it. 2 years later, with results to hand, everything had changed. Back in photos, no problems, talking in public. And to quote him, he'd got his life back. Right. And that's when I realized it wasn't about vanity at all. There was a very large confidence, self-esteem, just a big mental health side to it. And men traditionally aren't very good at talking about it, but hair loss does affect people very differently. Some people don't mind it, some people embrace it and crack on with life, but some people, they really do struggle with it. And sometimes it's family members. They'll just make a gentle jibe, a little joke, and they'll do it innocently, but it'll really affect that person and it'll really bother them. So, we often end up doing the procedure. It's a 6 to 8 hour procedure. They open up and all this comes, flooding out, how they've struggled, how it's been very difficult for them. And it's a waiting game to get the results. But once they get it back, you can see as they walk through the door, you can tell that their stance as they come in, they're a completely different person. Yeah. Completely different.
And Marie, do you notice this in your clients as well? Is it worse for women? I mean, I think culturally, when women suffer from hair thinning or hair loss, it can be very, very upsetting.
Yeah, it's completely traumatic for them, I think. They come in and they always often say, it's worse than man losing their hair, because they're seeing it from their perspective as a female, and they are, for them, they're losing everything. It's a very emotive subject. I always have a box of tissues in my consulting room because they're just always crying. And as Dr. Moussa said, they just open up and it all comes flooding out. And I think it's nice when they come because they know we understand. Well, often people will say, "Oh, you look fine," or everything's okay. I don't know why you're so bothered about this. But when you're struggling with something and you're losing confidence and it's affecting your day-to-day life, this is really important. And I think people can dismiss things, and as Dr. Moussa said, sometimes it is your family members. So it's a big step for them to come in and express this with us.
Absolutely. Yeah. So this is a sort of subspeciality now, isn't it? I mean, and it's growing very fast.
It is, yes.
So you see women, and in general practice, we might start with, your hair's thinning. Let's do a thyroid test to see you're not underactive with your thyroid. Let's do a test for iron levels, because iron deficiency. And sometimes there might be an underlying issue for patchy hair loss, such as fungal infection or alopecia areata, which is an autoimmune condition, which is a separate thing, and would have a bearing on the treatment that can be offered. But other than that, that's where general practice tends to finish. Yes. So there's not much we can offer if we rule those things out, but you can offer a great deal more. So apart from scalp restoration, scalp hair restoration, you can now do eyebrows, you can do beards, you can do the procedures that you've talked about, the more intimate procedures.
Areas.
And is there a demand for that?
There is, yes, there is. As I said previously, some people really regret it. I've also had patients come in and didn't want to remove it in the first place. Previous relationships.
Okay, they were coerced into or encouraged to.
And then one of our patients that we had, she had a divorce, and it was a statement for her. It was empowering for her to regain this.
Right.
So it can be quite shocking and alarming to other people, but it's an intimate subject. But for this person in particular, it was really important and empowering for her to get her hair back.
So when you're restoring hair to the vulva,
yes,
where does that come from?
It actually comes from the scalp hair.
Okay, and does it grow as fast as it does on the scalp?
It does. So when we really relocate the hair from the donor area, it actually just behaves exactly as it were when it was once on the scalp. So it will continuously grow. And so the grooming is a little bit more, tricky in a sense of you will have to manage that more mindfully. If you were to allow it grow, it could continuously grow.
Okay. And is it the same with the eyebrows, if you're restoring eyebrows?
Yes, yeah. So, our default zone to take hair from is generally the back of the head, and that is your strongest, most permanent hair, or the roots. So we tend to take from there and then put it wherever you want us to put it to. There are certain situations where if patients have had multiple transplants, for example, and their donor area is starting to get a little bit thin, we can look at taking it from elsewhere. Yeah. So we can take chest hair, we can take beard hair, and we can transplant that as well. We have had patients where because of, as Marie said, the hair at the back of the head just grows. So eyebrows will, left to their own devices, they will just keep on growing. So we've had some ladies wanted to take it from the pubic region into the eyebrows on the basis that it will not grow as long as hair from the back of the head. So they don't need to trim it as often and as regularly.
So it almost sounds like hair from different parts of the body has a mind of its own in terms of hair growth.
It will mimic wherever it came from. Okay. So if it came from the chest, it'll grow to that sort of length and that shape, and beard hair will always be a little bit coarser and stiffer. So we'd never put that on a hairline, for example. But if someone's had multiple transplants, they want the crown padding out a little bit, a little gap filling in, you can take some from there and put it, and amongst the other hair, it wouldn't be noticeable.
And what about beards?
So beards, again, we tend to take it from the back of the head. We tend to, and do that. It will grow. It's the simple principle. It's a very, very simple principle.
Would this be for people who haven't been able to grow a beard ever, perhaps?
So yes, there are men that will have very patchy beards. They'll have a nice goatee, but they'll have nothing on the cheeks, for example. So they will want to, they'll want to be able to grow a full beard. Some men, again, can't grow much of a beard, and if they have quite powerful jobs, they look a lot younger than their peers, and people don't take them as seriously. So they will want a beard just to look a little bit more mature, just so that people take them a bit more seriously.
I heard about a policeman who apparently felt he looked too young.
Yes.
And consequently, when he was trying to arrest people, he was getting a lot of resistance because he just didn't look as if he could be capable of arresting them. Yeah. Is that right?
Yep. No, we do have patients like that, yeah.
Interesting. So when people undergo these procedures, and I know that you give them lots of counselling first, you explain the benefits, the downsides, the risks, and the aftercare as well, which is very important. Is it a painful, lengthy procedure? What's involved? For say a woman had laser treatment to remove pubic hair and was having it restored, what would be involved?
So, of course, we go through a full consultation with the patient, and during the procedure, we always let them know that the procedure takes about 6 to 7, 8 hours for pubic hair restoration. It's a team effort. So Dr. Moussa, for instance, if he was the lead surgeon, he would be managing the surgery on the day. So we work with technicians, and if I'm involved, sometimes they like me to help design their pubic area. So we would begin by designing and outlining the perimeters of where the hair restoration would be. And then the actual procedure would take place. So it's done by using local anesthetic. So the back of the head, depending on which method of extraction has been chosen, that step would be first. So extracting the hair from the back of the head. So deciding whether it would be FUE or FUT would be predetermined before the actual surgery day.
Okay.
And then once those hairs are removed, they are harvested. And that simply means that the technicians are in charge of sorting through the hairs and simply dissecting them, so preparing them. So follicles at the back of the head, they actually grow in multiples. And in order to make the restoration look natural, we're actually trying to create smaller grafts. So creating grafts with single hairs and double hairs usually. The multiples that are high, they wouldn't look so natural down there. So we want to make sure we only got the correct and suitable amount of grafts that have single hairs and double hairs. And then moving on to the area, once the perimeter has been designed, it would be numbed by doctor, of course. So that the local anesthetic is a little bit uncomfortable. That's, the uncomfortable bit, a bit like going to the dentist, I say.
Sure.
You've got to get the area numb. But most of the procedure is, relatively pain-free. It's a long day, so anesthetic can wear off. But, we try and make sure that our patients are as comfortable as possible.
Yeah. And it's all done in the same day. People go home at the end of the day.
Yes.
But it's a very sensitive subject, and it must be quite difficult for some women to, first of all, summon up the courage to come and see you, and then to talk it through. And presumably some of the technicians are in the same room where the procedure's being done. So they have to be put at their ease, and some sedation involved, presumably.
Yes, there is, isn't there, Doctor?
We tend to give some diazepam, which will just calm them down, relax them. But generally, just talking to patients, just, giving them the opportunity to say what they want, what they're after, that will usually just put them at their ease. And we try and keep things fairly easygoing. We're not too, sort of harsh and strict. And just giving them their time, it's not difficult to make patients relax. Yeah. Generally, what we find is they get to the end of the day and they say how much easier it was than they thought it was going to be. That's the overwhelming feedback we tend to get.
Yeah. And when they come back in days and months afterwards, what sort of things do they report?
They tend to wish they'd done it sooner.
Oh, right.
The vast majority say, I wish I'd done this sooner, because it's generally a safe procedure. And as long as you've listened to what the patients want and you know what they're after and you work around that, it can be achieved quite easily. Yeah. So, the results are generally phenomenal.
But is there not a danger danger if a man, for example, with thinning of the crown, has it done too early, he could continue to lose some hair around the graft area?
So this is a risk. So ongoing hair loss is always a concern, and it's one of the things that we have to counsel them about before we start with it. We can move hair from one part to another, but we can't control ongoing hair loss. We have a discussion with them about medications which can try and put the brakes on that, so reduce the chance of further hair loss and therefore reduce the chance of another procedure. But we never force it on them. It's always a choice. Hair loss at the end of the day and its management is very much a patient choice, and they need to weigh up the pros and cons and what they're willing to do. As long as it's done sensibly, we always leave enough hair at the back of the head to be able to come back second, third, sometimes 4 times just to be able to get to the end result. There was a time in the past where people under the age of 30 wouldn't get through the door because we were so limited with how many grafts we could take, because the instruments weren't as fine, the techniques weren't as fine. These days, instruments are a lot finer, techniques are a lot better, so we're able to harvest a much bigger number of grafts safely. So with that, we've been able to push the numbers higher, so the age of people having it done has come down. And with that, we've had to tackle this ongoing hair loss issue. And as long as patients understand that and are aware that, they may need more procedures as time goes by, we're sensible of the graft numbers. We don't go out for, gold stars that we've got the biggest number everyone's ever achieved. It can be done very safely, and they can have more than one procedure, and throughout their life, they live their life having a very good head of hair.
How many of your clients have already tried the things that they can buy over the counter at the pharmacy? So I talk about Regain and medicines like that.
I would say most of them, most of them, and lots of different products that they've heard. Social media's really impressionable. So, they'll come in and say, I've tried, I don't know, peppermint oil or something, and but my hair's still falling out. Or some will actually have no idea about any DHT inhibitors or any medications such as minoxidil. So for every patient is different, and there's always something to be learned.
Yeah, you mentioned DHT. We're talking about dihydrotestosterone, and there's always this enduring myth that men who lose their hair have got more testosterone and they're more masculine. Actually, that's not the case, is it? It's just that those hair follicles it genetically are more susceptible to normal levels of dihydrotestosterone.
Yes. Blood tests, if blood tests are done, the levels are not crazily high or anything like that. It's just they are genetically more susceptible to it. Yeah. It's medicine, there's a lot that we know, but there's also even more that we don't know, and this is just one of the curiosities of medicine.
And Ahmed, how did you get into this? Because you were a neurosurgeon, you were operating on people's brains.
Yes,
it seems like a big culture shift there.
I was told it's still the head, just don't go too deep. But it started off with a colleague of mine got asked to do it to be able to take the strip out of the back of the head. A lot of people's backgrounds in hair transplants vary a lot, and not everyone has a surgical background. So being able to do a strip is something that not all of hair transplant surgeons can do. So he got asked, and they just saw how easy it was for him to do the whole thing. And they said, do you have anybody else? And he gave them my name. I declined 3 times to start with, until I went and actually saw the patients, and it was seeing the effect and impact hair loss had on men and what getting it back meant for them. That's what got me into it. That's what made me agree to go along with it.
Interesting. How about you, Marie?
Well, I was just going to say that doctors didn't actually like doing eyebrow hair transplants also until recently, and he's been working with a lot of the eyebrow hair transplant patients, and you thought it didn't really affect these women so much, but it changes their lives, and they you've seen how confident they are.
It completely changes them. You can, as I say, they walk in the room, and if you remember them from beforehand, they're a different person. I've had patients where I remember one recently. He said he'd been struggling. He'd lost his job, and he'd struggled through interviews, and he'd gone to interview after interview and just not made it. And after he'd had his hair transplant, he changed, and he was just so much much more confident, and he was able to sit in an interview and just answer whatever they threw at him. And he said, I've got the job I've got because of the confidence I've got back from the hair transplant.
And there must be patients that you can't help. Patients, for example, with alopecia universalis, where antibodies basically destroy the hair follicles. So even if you were to transplant new ones, they would be destroyed as well.
That's correct. Yes, I mean, there are limitations. Hair transplants. We are limited by the supply of hair that we've got, and we are limited by the condition that the skin may be in. For patients like that, a hair transplant would be futile. It would not work. There are other things they can do, wigs and hair systems. Some people do scalp micropigmentation. So there are options for them, but it wouldn't be a hair transplant.
What are some of the more bizarre cases you've been involved in? Some of the things that perhaps don't get much recognition or coverage in the media. Any peculiarities?
Well, they would certainly come to us.
Yes,
that's for
yes.
sure. I think it's mostly the patients that really are not wanting to remove from their donor area, so using other body hair as their donor area, because it's something that we can do, and it can be seen as filler hair, but for optimal and most natural looking results, it's not something that we encourage.
Yeah. And it's true to say that you're busier than ever. Demand is increasing as you become more successful and word gets around. And certainly I've learned a lot during this podcast. The word gets around and more people come to you.
It is a booming industry. I think people, it's a lot less taboo than it used to be. The idea of being unhappy with something about yourself and wanting to correct it. It's a lot more acceptable these days. And we hear a lot of patients that are very reluctant to do it. And sometimes they will try and keep it from friends, colleagues. And they are often very surprised by how many people around them who already had it done or wanting to have it done. And people are just generally very supportive. It is booming. And, your question about strange things, we have had patients where they've managed to style their hairs in ways that they've kept it hidden from partners for sometimes 3 or 4 years. They've managed to style it to do that. But they've now gone along with this, and it's a case of, well, how do I go home and not tell my partner? And that's always a difficult one. It's once you've had a transplant, it's a little bit difficult to keep it. But for colleagues at work, we can do procedures without shaving, so the impact on the outside world is a lot less obvious, a lot less noticeable, and the results just come through slowly and insidiously, so that it's only if people look back at an old photo that they suddenly think, hang on, something's changed here. But it's very successful.
There's so many different reasons why people would want a hair transplant also. Sometimes we have female patients who perhaps don't like the size of their forehead and previously have had cosmetic procedures to shorten their forehead, but that often left them with a linear scar, and they would have to come and have a hair transplant on top of that. So people are finding ways to skip that step, and we can lower the hairline slightly just by doing a hair transplant. We also get people who are transitioning and they want a more feminine hairline. So there are so many different reasons why people look for hair transplants.
Just give us a realistic timeline. So somebody comes in for one of the commonest procedures, which is, restoration of the crown and the temples. How long would it take them to see results?
So the procedure on the day is about 6 to 8 hours, and at the end of the day it will look a little bit red and a little bit sore. They aren't in any pain at all. Anesthetic's still working, and we give them paracetamol, so they tend to stay quite comfortable. But to family members around them, it can look a little bit raw if we've gone down the shaven route. They typically have a bit of swelling for 2 or 3 days. They'll have scabs for a couple of weeks, but after that, if they've shaved, they'll just look like they've had a buzz cut. If they've not shaved, they'll just look as they always have done. Transplanted hair will often shed in the first month, so the stubble that they had from the transplant will disappear, and then it'll take 2, 3, sometimes 4 months for it to start coming back. Initially, might look a little bit sparse, might look a little bit spiky and wiry, and it's just a waiting game at that point for it all to come through and for the hair to soften and settle and look more natural. I always say, being in the industry, we can spot a transplant fairly easily in the first year. But usually it's a year, it's more difficult for us to tell, and patients are usually very happy. There are exceptions, and we have some patients that 7 or 8 months look amazing, and, people can't tell. But we tend to be, stay a little bit more on the safe side and say, aim for a year. Anything sooner than that is a bonus. Okay. There's the odd rare one that takes a little bit longer, might take an extra 2 or 3 months, but a year is a good point to target.
Okay. And are there any complications that people need to be made aware of?
Medical complications are very rare. Your infections, your bleeding, your scarring, grafts not taking, those are very rare. The two things that we are always mindful of making sure patients are aware of, one is, as you alluded to earlier on, ongoing hair loss. So the idea of doing a transplant and guaranteeing that you'll never need anything for life is fiction. You might get lucky and never need anything else, but you can experience more hair loss from the native hair. So the transplanted hair will stay in the same way that it stays at the back and sides and never goes. It will stay on top and never go. But existing hair may go and they may need something else. The other thing that we always say, bear in mind, is expectations. A hair transplant, we are creating the illusion that in a normal social situation, you look like a guy with a full head of hair. But, if you shine a bright light and you try and see whether you can tell whether you've had a hair transplant or not, certainly someone in the industry would probably be able to tell. But, the good transplants after a few years, even they can be difficult for us to spot.
Yeah. And I imagine that you have clients who are reassured if you can show them before and after photographs of other clients, or even put in touch with other clients.
Yes. I mean, we're very fortunate in a lot of our patients. They usually come from either friends or family members of people that have already had it done. So they've seen what it can do, and they've come saying, I want what X, Y, or Z had done. But for the other ones, we have a portfolio of befores and afters that they can look at and they can see. Perfect. We always caution them that everyone is different, but generally it is a very safe, successful procedure.
And I see that there is a trend now for many people to have a very straight line and a very angulated vertical transplantation done, particularly in Turkey. What are your feelings about that?
I think some ethnicities can get away with it, but I think, we try to keep things more conservative and natural looking.
Does it have a name, that
I call it a Lego hairline.
Lego?
I call it a Lego hairline.
Oh, because it's so straight? Okay.
Yeah, I mean, we tend to try and avoid things like that. The aim behind the transplants is to go from being eye-catchingly bald to looking normal, to looking like where you would be in life if you'd not lost hair. Yes. The aim is not to look like you've had a crazy hair transplant.
So less is more sometimes.
Yes, exactly that. There are, people label a particular country as being bad. They do have good places over there, but the problem is, whether it's down to regulations, whether it's down to price, it's difficult to know. But if you are going to do this, you do need to do your research. You do need to make sure that you are going to a reputable clinic, that, the doctors and the team there have experience, they know what they're doing, and there is follow-up, there is backup, there is ongoing care with it. And as long as you make sure of that, then you shouldn't go wrong. Hairlines, there's tricks that we do. You can tell by someone's head shape that a particular hairline would work, where the hair is, fine little baby hairs. So there are things that we can do to make sure we get it right. Patients will often try and overcompensate. The lack of hair makes people want to go lower and lower and lower, and sometimes you just need to counsel them and explain the rationale behind it. And as long as you speak to them, you listen to them, then talk to them and explain it, most of them will listen and most of them will be on board. And the vast majority of patients, that have been pushing for lower and lower hairlines, when they come back for the results, they say, thank you for not going lower. We hear that so often.
You have to be so careful with trends also, I say. So sticking to something that's natural is better. I see it a lot with eyebrow hair transplants and the shapes that they want depending on the period. So maybe 3 years ago, everybody wanted this sort of elaborate foxtail, very angular shape brow. And I would always sort of advise them, this is very popular right now. It's a great trend. Even I like it. But it's not a very neutral, natural shape that you can play about with. It's almost Spock-like. And of course, 3 years later, nobody's asked for this shape now, and everybody wants a fuller brow. But a classic brow I think is best. Classic shapes.
Absolutely, good advice. And I know many patients who've come through the Wimpole Clinic, and they speak very highly of their treatment. I mean, your compassion and sensitivity comes across. You know, you look after patients very well, and all of them say that they've had really excellent results. We should probably, to wind up, talk about cost, because obviously this is not available on the NHS. And I know it's difficult to say what any one client, what they could expect to pay, depending on the procedure. But is there a sort of general guide to what this kind of treatment would cost? If this is scalp surgery, for example.
I mean, the prices vary a lot depending on the size of area that needs to be covered, dependent on the texture of hair that needs to be done. Is it a scalp procedure? Is it eyebrows? Is it beard? So the complexities will vary a lot. I tend to, as the doctor, keep out of this one and pass it over to Marie to answer these sorts of questions.
Okay, Marie. So,
I mean, depending on grafts, so for eyebrows, for example, prices start from about £4,500, and then depending on how many grafts, how thick they want them, how large the brow is, it can go all the way up to £8,000. As Doctor said, depending on the method that is required, these prices can change. For scalp hair restorations, I would say an average price is probably about around £5,000 to £6,000.
Okay, and for the more intimate procedures?
It's a little bit more expensive because, of course, it's a more specialised area. That can range from £8,000 to £10,000.
Okay. But as you say, for many people, this is life-changing, completely life-changing. Yes. It gives them their confidence. So that's got to be money well spent, I imagine.
Absolutely.
That's what people say.
Yes, yeah.
Well, I've learned a huge amount during this podcast. It's been absolutely fascinating. I know what you're achieving is amazing. And as you say, it's a burgeoning, growing, booming market. So carry on the good work.
Thank you very much.
And thank you for enlightening me and all everybody who's subscribing to the podcast.
Thank you very much.
I'll be very interested. Thank you. You can watch all my interviews on the Dr. Hilary Show YouTube channel, including my recent conversation with Dr. Anita Raja.
We've got men who are very young. They're overweight, they have poor sleeping patterns, they're using their screen till late night, and we now have evidence to suggest that if you are overweight, there's easternization, so you lose your testosterone. If you're using a blue light till late night, that is depleting you from your testosterone. And if you've got poor sleep, not good quality sleep, but by good quality sleep, I mean at least 6 to 8 hours of sleep, which is uninterrupted through the night, then that could affect your testosterone levels. And we get so many young patients who come through the door and their main symptom is fatigue, tiredness. They're tired all the time. And when we do offer them a full health screen, which includes their hormone levels, then sometimes we do pick on the fact that their hormones are just very low.
And before you go, for the latest health news delivered straight to your inbox each week, subscribe to my newsletter at drhilaryjones.com. We'll keep the conversation going about your health, your well-being, and what truly matters to you.